oculoplastic surgeon, I want to learn how to do eyebrow transplant. Is that reasonable? I said, that's the last thing you should be touching. But you know, that's like, here's male hairlines, temporal points, a little bit above the ceiling is the eyebrow. So don't start with that, all right? Even though it's a small case, it's very advanced. And so why talk about eyebrows? Because you just need to know about it intellectually. You're not going to sit down, memorize, and write down everything of how to do this, but in the next 10 minutes, I'll explain this. So the trend today, as you know, are fuller eyebrows. What are some of the indications? Today it's overplucking. Why? Because back in the old day, the trend was to be having thinner eyebrows. Congenital thinness of the eyebrows could be traumatic in nature. It could be a scar, cancer reconstruction. I'll show you before and after that. Thyroid disease, some metabolic issues. And these are indications that you can transplant. But the things that you want to look out for are what I already mentioned. You're going to hear this 10,000 times in this weekend because redundancy is the only way you're going to learn this. FFA is a huge one. Alopecia areata, but that's usually, I mean, if they're involving the eyebrows, unless it's a patch, they're usually like gone, okay? It's pretty obvious you're not going to have any donor to transplant, but they could have a patch loss. Something is, you think, what's going on? Short-term thyroid, you may want to just, hey, let's try some medical therapy, see if we can reverse this. But if it's been there for a long time, I'd transplant. Trichotillomania, I've transplanted this, but you got to be careful and make sure that this person stopped doing this, pulling out the hair thing. Otherwise, not going to work. So just a general conceptual design is you can mark out the medial canthus going up as sort of the start point of the eyebrow. Although I had one gentleman, I think he wanted a unibrow. I had to spend like 30 minutes talking him out of this. I've never had that before, but I finally coaxed him into getting something a little bit reasonable. You don't want to design bad work, all right? So, you know, patients can ask for things, and if it just does not suit your taste, then you got to have a divorce or stop dating that person. And then just the line going up through the alar crease, and as you see, it goes up through the mid-pupil. That can be an arch point. These are for female brows, obviously. And then if you go up from the central lip all the way through the lateral canthus, that can be sort of the end point for your eyebrows. These are just rules. They're just rules. You don't have to follow them. It's great to break a rule when you have to, because sometimes it doesn't fit someone, and everyone's got different shaped brows. There's no absolute definition, and again, these are more for female designs. Males have much lower brows. So I just mark it out with Gentrified Violet, and when you mark it out, make sure you decide, am I going to make my sights on the purple or in the purple? So like a lot of times I'll do it inside the purple, and I'll just know that's where I'm marking. I start with an eyebrow pencil, make sure it's good, then mark around the eyebrow pencil, and then I design inside the purple. Sometimes I design on the purple, but be consistent. So just quick thing of how I do this. Their patients are pretty awake for this. I put in little drops of 1% lidocaine in little aliquots because it's less painful. I use multiple vibrations. I have one vibration proximal to the injection. I have another one distal over somewhere far away where they're vibrating on their jawbone. The more vibration, the less pain, and I'm vibrating my finger. Then this is actually something I learned from Jim. I use a little septicane, and I put the vibration to bridge those dots, and I just place a little septicane across there. It gives me a very profound anesthesia with less discomfort. And then this is just showing the patient holding another vibration device. Then I put tumescence into the area. Now I don't typically for the eyebrow score with a multi-blade. I'm doing this really to show you how I do a larger donor area. I mentioned this to some of the students that were in my FUT donor section of the lab. But I like to score on larger cases because it allows me to get exactly that width. And I use that width as a calculation for grafts. You heard me talk about that. So then I do to mess along those scored lines. Again, for eyebrows is overkill, but I'm just showing you how I try to get very consistent graft yields when I'm doing larger cases. When I inject the eyebrows, I just go outside of the eyebrow so I don't mess up my lines, and I just micro pulse little aliquots of lidocaine with a 32 gauge. And I typically use 1 hair grafts and 2 hair grafts. I find that in my hands, all 1 hair grafts don't give me enough density. In the 2 hair grafts, if you pick a patient without really coarse hair, it looks very natural. Now, of course, you got to be very careful and understand how to design this. So the 21 gauges I use for 1 hairs, 20 gauges I use for 2 hairs, and you want to create this sort of cascading fishtail, which it goes up, over, and then it sort of blends together. And then this is showing you that I'm just marking the perimeter for 1 hair grafts first, You want a very, very, very low angle. It's a flush to the scalp, okay? And I'm doing it on the purple here. Then you want to this is a key point, is as you go to the tail of the eyebrow, turn the head, because as you're going here, there's a tendency to go too high at the tail. So the more you turn, the lower your angles will be. So I progressively try to get as low, because the head is round. So I'm trying to go low, low, low all the way across as I'm marching across it. So this is just showing you one hair sites completed. These are coronal sites, meaning they're like this. They're very hard. So this is like the ultimate difficulty. And it's not only just difficulty designing it, your staff have a hard time seeing coronal sites, and it's very hard for your staff to place with this. So you have to have the best that you can doing this, otherwise you're going to have a problem with this. So these are just 2 hair sites done coronally. Again, you can see what I mean by coronal. Okay, that allows the hairs to sit flatter. That's why I'm doing that. And then just showing you, I'm making some 2 hair sites with the tail. Okay, again, very, very low sites if possible. And this is just showing you all the sites are completed. Then I transfer into a 1 cc the PRP, and then I inject the PRP into the area just subcutaneously and massage it. I don't put a lot in there, about a cc or 2 per side. And then a few things that you need to do is make sure that when the grafts are placed that the curl is down. Remember that you heard about the hair curl yesterday. You don't want them sticking up. And check, double check, triple check. I have the patient get up and I look and then readjust, okay. And fuss over it, because you don't just make an eyebrow and then leave. You really need patience. It's such a finesse thing. And tell patients at the very, very end, if there's something off, they can always pull it out, you know, after a few days when the edema is settled. So that's important. And then offer alternatives. Today you can do microblading as well, which is a very natural looking treatment, but it's all artistic as well. So the advantages and disadvantages of each one. Microblading is temporary in nature, but it just takes a small procedure to do it. It's easy. It can even touch up an eyebrow transplant. But eyebrow transplants, for me, the big thing, if you do a really good treatment for them, is they need to weekly cut the hairs. And there is some thought of something called recipient dominance, which means after a few years, they don't need to cut it as much because the hairs slow down in growth. But I always tell the patients they may need to continue to do this. And it's not reversible, but I can tell you I have had patients with just horrible results elsewhere that they just plucked it all out and I just started from scratch. So it is sort of reversible in that regard. You can pluck it out. This is a good thing. We give all our patients thinning scissors, because if you just take straight scissors and cut, first of all, it's difficult and it doesn't look normal. So I don't know if people are any hairstylists in the room, when you have these thinning scissors you can get on Amazon, when you shear the eyebrows and trim them with these thinning eyebrow shears, they look so much more natural looking and they're so much easier to trim. So I just give all my patients a set of these and it makes it so much easier to work with. So this is just showing you traction loss and eyebrow loss. This could masquerade as FFA. So this is something you gotta not just say, oh, I'm just gonna, just transplant this. So be careful. If something doesn't look right, biopsy. Have a low threshold to biopsy someone. And this is just a lady that sent me a photograph saying, hey, I'm happy. Look at the frame to the eyes, the joy it can give. This is a lady that I did hairline work and eyebrows as well, so you can show you the combination. You can do both of those. This is a lady that had tattoo eyebrows that I just corrected with transplants. In African Americans, it's a lot of people worry it looks unnatural. I think it looks great, but you got to be careful with understanding that it's going to be curlier than a normal eyebrow. This is just a lady I showed you earlier in the last lecture, a lady that has a tattooed area. You know what? A lot of people think tattooed areas, the eyebrows don't survive as well. I find it actually survives pretty well. I think it's a lot of the regenerative techniques I use there. And also, I like it because if they don't remove it with the laser, I just cover it, and actually in a single session they can get what looks like 2 or 3 sessions of transplants, because that background color serves to decrease the contrast ratio. Cancer reconstruction, this is on the left eyebrow, on your right, just a small treatment. I did this many, many years ago. This is a lady that on the top has had 2 transplants using the robot, which to me sounds crazy, but you can do it. It's not wrong. It's just you know, the guy only does robotic hair transplants because that's all he does. He just did it, and he's never had experience doing eyebrows. So she had 2 sessions. She had to pluck everything out, and then we just redid it. You know, so this is something where if you're not really skilled at doing eyebrows, don't start doing it. So eyebrows can be beautiful, can be dramatic, and can be natural, but this is, again, a very, very sophisticated, the highest level thing that I'm teaching, and that's why I just spent 10 minutes going over it, so you just understand the overview more than anything else. Okay, Jim?